The U.S. Surgeon General is issuing a warning about the mental health risks that social media has on young people.
Health officials say while we're still learning more about social media's effects, there is ample evidence it may pose a, quote, profound risk to the mental health and well-being of our children.
For more, let's bring in Dr. Ariana Howitt. She is the Executive Clinical Director of On Our Sleeves and pediatric psychologist at Nationwide Children's Hospital. So great to have you. Tell us why children and adolescents are affected potentially more by social media. How are their younger brains particularly vulnerable?
Sure. So children and adolescents are a time in development where they're taking more risky behaviors. Their mood fluctuates a lot more than adults. They're also really developing that sense of self-identity. They really care what peers think about them. And their executive functioning isn't quite developed. So they can't set their own limits in the way that adults do. So when you think about social media and their exposure to information, like those challenges we hear about, things like exposure to self-harm or eating disorder behaviors. And then, of course, just that self-comparison and thinking of themselves as a brand and constantly worrying about what others have to say makes sense because of where their brain is in development.
Right. Hearing you list all of those ways in which the brain is still developing at this point, I'm just thinking of all the various challenges, for instance, that you see on social media that circulate and how a young person in particular, right, might be susceptible to some of that in a way that perhaps an older adult might not be. So the Surgeon General is calling on lawmakers, tech companies, and parents to safeguard against the potential risks. Let's start with parents. What can they do to protect their children?
Really important for parents to have open communication with their children on everything, but of course, too, on social media. Having conversations about how you're using social media, what do you like and don't like about it, and encouraging kids to think about the effects on their behaviors and mood. And then also a big part of a parent's role and a caregiver's role is setting boundaries. So we recommend a family plan where you talk about what platforms can you use. What are the off-screen times that we have as a family? What other activities do you have to participate? And things like privacy, what can you post and what can you not post? And set those expectations ahead of time and continue checking in as kids use the platforms.
And on a broader level, how can lawmakers and tech companies work together to try and put social media policies in place that would protect especially younger people? What would those policies look like?
Yeah, I really appreciated that the Surgeon General highlighted that it can't just be on the parents and the kids, that we have to have system changes. And so being able to work together, for example, to share the data that technology companies have so that we can have better research to understand the impact of social media on kids. Other recommendations are funding for this research, funding for curriculums that help children understand how to use social media. And then, of course, developing the platform so that they're not developed to hook kids in and use their data and feed information to them that can be harmful.
You know, Ariana, as parents, I wonder, what are some of the warning signs, the red flags that we can watch out for to get a sense of whether or not our child, our teenager in particular, might actually be susceptible or sort of falling into a bad pattern when it comes to social media? Because, you look and a child scrolling is not an uncommon sight, but what is it specifically that parents need to keep an eye out for?
You want to look out for those offline behaviors. Are they withdrawing? They're not interested in the things they used to be interested in. Or when they are doing offline activities, they just want to get back to their phone. Changes in their mood and their behavior that last long periods of time, like it's almost every day for weeks. They're irritable or sad or nervous. And then, of course, you want to look out for changes in their body image, their eating habits, or those risk-taking behaviors we discussed earlier.
All right. Really good advice, Ariana Howitt. Thank you so much. We really appreciate your insight.
Thanks for having me.